Hello, I'm Jeremy from the First Aid Team, where we teach people to save lives. Today looking at sprains, strains and suspected fractures. Classic scenario, somebody's had a bit of a tumble, landed awkwardly, perhaps hurt their wrist. There might be swelling, there might be bruising, and of course we don't know whether it's just a soft tissue damage or indeed whether there might be a broken bone. And just because people can move things does not mean there's not a break under there. So quite clearly, at the end of this process, we do need to encourage our casualty to seek medical treatment at a minor injuries unit or indeed A&E. We might consider icing because the acronym we use in this situation is RICE. We encourage the patient to rest, keep it in a comfy position. We would apply ice. Now if you have ice packs, these are brilliant. You may not have these to hand, so frozen peas, just ordinary bag of ice, are absolutely fine. Just remember, if we're doing the ice element, put something between the skin and the ice to stop it sticking. We should also encourage the patient to keep it in place for about 10 minutes to help reduce any swelling. Once we've reduced the swelling, they've done the ice bit, we now need to put a bandage on. In your first aid kit, you'll have something like this. They're called conforming bandages. And we simply rip it open. They're not sterile, so no use by date. And the material is highly elasticated. And we need to use that elasticity to compress the injury. In this case, Freddie has done her wrist a minor ding. I've taken a history, I understand what she's done. We've iced it, and now we strap it. So if you can just bring your arm forward for me, please. Start, if you can drop your arm so the camera can see. We start by taking a turn around the wrist, a few inches up the wrist, a few centimeters, it's not critical, but bandage over so it grips. Handing it to yourself around the limb, come down to the wrist, if you'll turn. We then come across the back of the wrist, around the palm of the hand, between the thumb and fingers, crossing over on the back of the hand. Come around the wrist again, and moving up, we overlap, trying to get a crisscross going across the back of the hand. Perhaps come down to the wrist again, and repeat the process, crossing over until we've used all the material up and finishing off around the wrist. Tying it off or taping it down using your microporous or surgical tape. We can check circulation by, if you'll tip, giving a little squeeze to make sure it's not too tight, and off they go to minor injuries. So there you go, a very simple approach to a strain, sprain or suspected fracture to the wrist. I'm Jeremy from the First Aid Team, teaching people to save lives.